Dr. Ryan Whitaker had always known that medicine was more than science. It was service. At 29, fresh out of residency and full of purpose, he took a placement at a rural clinic in southern Africa, eager to make a difference where resources were scarce but the need was overwhelming. Each day was a whirlwind of activity. Malaria, tuberculosis, HIV, diseases he'd only read about in textbooks now, had faces, voices, stories. He treated patients under trees, in makeshift tents, by candlelight when the generator sputtered out. Gloved hands became second nature. So did the exhaustion. One night during a chaotic delivery of twins in a remote village, the clinic's nurse was nowhere to be found. The mother hemorrhaged. It was a race against time. Ryan dove in. No time for extra gloves, no backup. In the flurry, a scalpel slipped. Just a nick, a sting. He washed, bandaged, moved on. Weeks later, he noticed fatigue, night sweats, a low-grade fever that wouldn't go away. He ordered his own test. Positive. Ryan sat alone in the exam room that evening, staring at the paper. He wasn't angry. Not really, just still. The silence felt louder than the diagnosis. His hands, once so confident, trembled. The news spread quietly. Some colleagues distanced themselves. Others, especially local nurses who had seen it all, simply nodded. "You kept her alive," one said, referring to the mother he'd helped. "That matters." He stayed. He learned how to manage his condition, to counsel others, to fight stigma not just with facts but with his story. He became both doctor and patient, healer and advocate. Years later, when asked why he stayed, Ryan would smile gently and say, "Because life doesn't end with a diagnosis. Sometimes that's when it begins." And in a small clinic with flickering lights, where life and death dance closely, Dr. Whitaker's heartbeat, steady and full of compassion, remained part of the rhythm.